Now, a total of 59 deaths out of 1,773 total COVID-19 fatalities in the country are cancer-related. The statistics, which translate to 3% of COVID-19 patients with cancer as an underlying condition. Now, the grim reality comes as the country joined the international community in marking the World Cancer Day. The Ministry of Health says cancer screening services from level 2 hospitals are scheduled to be rolled out from next week.
According to the Ministry of Health, cancer is the third leading cause of death in the country and the second leading cause of non-communicable disease deaths in the country. Most of the deaths are being attributed to late diagnosis, among other factors.
With the most recent estimates pointing to an annual incidence of over 42,000 cases and 27,000 deaths.
Many families have been left financially strained in seeking treatment. Such is the case of Grace Washeke, a 34-year-old cancer patient. She was diagnosed with cervical cancer a year ago. News that doubled her tragedy, as she is also HIV positive.
Kaenda Kiabu, wakanipima, wakaniambia ni cancer inakuja. Then Kwanzia hapo nikawa nateseka sana, sikuwa na pesa.
Doctors advised her to seek urgent treatment, but that threw her into a state of confusion amid the tough economic times occasioned by the COVID-19 pandemic. She needed 1.5 million shillings for her treatment.
Bia sasa hapa sina otherwise. Nimejaribu kutafuta mtu wa kunitibisha hii kansa, nimekosa na sina job, I'm jobless, bwana yangu alikufa, mimi sina otherwise. Wakanitia Ministry of Aid. Ministry of Aid wakakuja wakaniambia, okay, tutakusimamia kwa sababu nilikuwa nimetengwa, hata familia yangu walinitenga.
While financially constrained, medics at the Kiambu Level 5 Hospital organized for her treatment at the Kenyatta National Hospital. A week ago, Grace completed her last dose to suppress the disease. She, however, still awaits further tests in the near future. And as the country joins the world in raising awareness on cancer, encourages prevention, detection and treatment, under this year's theme, I Am and I Will, Grace Washeke is among many cancer patients who every day hope for a better tomorrow. Statistics from the Ministry of Health show 59 COVID-19 fatalities out of the total 1,773 were patients with cancer as an underlying condition. The ministry hopes that the implementation of the Universal Healthcare Coverage Program will reduce the pressure on most cancer patients.
Scale up the entire process, which will involve screening, promotive, preventive healthcare from Thursday next week. So Thursday will be in Nakuru County to start the process. So as soon as we launch, that service ought to be available.
The NHIF coverage for oncology treatment has greatly eased the burden for many of our cancer patients. I'm happy to inform you that the Ministry of Health is working closely with NHIF to improve the different care for cancer as per our.
But until then, Washeke, who now banks on friends for her basic needs, can only hope that the government will ease the treatment services for cancer patients. Kamchemenza for Channel 1 News.